Hello, welcome to another episode of Life with Artificials. Today we're going to explore the future of health. So, how about if we talk about artificial nurses? So, I would like to introduce you to my guest today, Michael. Michael, who are you and what do you do?
Yeah, first of all, thanks for the invitation. I'm Michael Lange. I'm CEO for Call, which is a health tech company here in Denmark. And we have developed a MIGO, which is an patient monitoring software program using by hospitals, specific the intensive wards where you have patient in the beds or in chairs, which need to have a nurse 24/7 at the bedside or at the chair to monitoring the patient. The software program can monitoring the patient instead of that you need to have a nurse sitting at the patient's bedside, and instead of that the nurse need to look at the patient all the time. The nurse will get a notification if the patient is doing something which the patient not have to do or not need to do or could harm the patient. An example could be a patient in coma. Even if you are very heavy sedated, you can try to remove your respiratory tube. And if you're doing that, you will die. And that's why you need to have a nurse sitting at the bedside.
Wow. So actually every patient in the ICU, the intensive care, needs to have a nurse that sits to their bedside to see if they have any behaviors which will endanger their lives.
Exactly.
That must cost a lot, right?
That costs a lot, yes.
Yeah.
And the idea came out from the University Hospital in Copenhagen, the Risk Hospital. They moved the ICU unit from an old building where they had multi-bedrooms to a new building with single bedrooms. And in that, you could say, moved, they could see that they need to increase the hiring of nurses, because in the old setting, they could have 1 to 2 nurses who covered 4 patients. In the new setting, it was a situation with 1-to-1, one nurse per patient. So they more than doubled the resource budget, and we know everybody that the public sector's budgets is under very heavy, you could say, pressure for many reasons. So they didn't have the budget to increase the nurse resources. So the ICU unit reached out to Call, and Siemens, which is also a partner, and we developed MIGO. And as mentioned, it's a software program who monitoring the patient through a camera where you can see the patient with a live video feed. And if the patient is doing something, try to remove the tube, there will come a notification to the nurse. The nurse has a cell phone, and there's an app, a MIGO app on the cell phone, and it will send the notification to the nurse, so the nurse can be outside the patient room. And the nurse can even monitoring more than one person. One patient.
Clearly. I guess I don't know now what the ratio is exactly, but it's clear this. Okay, so when somebody hears monitoring, right, of a patient, this word monitoring, I understand that it comes from the medical, world, but in the same time, we as citizens are very scared of this word, right? I mean, monitoring and thinking that, okay, sitting there in the bed and there's a camera filming you and you're actually not in the best time, of your life. What happens, right, with that video? Where does it go? What happens, and how are you using this in the algorithm?
First of all, both the patient or feedbacks from the patient and specific for family members has been very positive. Because even when you have a nurse at the bedside, sometimes the nurse need to leave the room.
Yeah.
And the camera will always monitoring the patient, even if there's not a nurse in the room.
Yeah. So they feel more safe.
Much more safe. Much more safe. Secondary, we don't record the live video feed.
Okay.
So you can see what happened in the second, but we don't record it. So you can go back and see on old video recording from the patient's bedside.
Yeah. Okay, so it's a live camera.
It's a live camera, and you can also you can only see what happened in you could say in real time.
Yeah. Okay.
Yeah.
Okay. So the nurse receives a notification, but not necessarily they know what exactly the patient did. So they need to come and
they will open for the application, open for the camera, and they can see the situation.
Okay.
Is it a situation they need to react on? Or is it okay?
Yeah, because this was my next question, right? Because I mean, if you have a motion sensor, and here again, I'm coming with an example from when we have the light sensors, right?
Yeah.
And you have them outside, and then all the passing dogs and the cats and the birds are just like fooling that. So you actually don't want to kind of stress, nurses in a sense of that there's a simple thing, flickering, or maybe a window that is open and there's some type of motion that comes next to it. So how do you make this difference?
It's very normal that you have a lot of different alarms, and there's a kind of fatigue of all the alarms, because it's maybe only 5% of the time when you get an alarm on notification that you really need to react on it. We have trained the software on around 54,000 different patient movements, body movements, and more than 100 million images. So we have really trained the software to only react if there is an detection which the nurse has choose to get a notification on. For example, one arm, right or left arm to the face, or that the patient tried to remove something from the hands, or tried to roll out of the bed.
Yeah.
That will give the nurse the notification, or notify the nurse that there's something which the nurse want to react on or look at.
So I feel it's an interesting combination in between an AI, right, an artificial intelligence algorithm that is recognizing, and it's trained to know what is, first of all, a movement that needs attention or not, but then also give the decision making towards the human to say, well, I think this, from my perspective, this is what I would judge, right?
Exactly.
So actually another layer of human judgment.
Exactly.
It's quite interesting to do this. I see the benefit, and totally I understand the fact that we don't need to put a nurse next to every patient is saving both like financial resources, right? Human resources, of course, the fatigue and the stress. But how else do you feel this is bringing value to, one, a hospital, and secondly, to a nurse, right, as a thing? And from here, after you give me this, I would like to extrapolate and see, well, what else, could make the life of nurses easier from your perspective, or from what you're working on?
That's a very good question. The MIGO software program will notify and record all the movements. So you can get a report from the system, for example, for the morning conference, where you really want to know if the patient, for example, have had a very, quiet night, or has there been many issues around the patient, because in the healthcare system,
That
we
might
know
affect also medication, right?
exactly,
Would have be a decision in what type of medication.
We know if the patient have a very quiet night, you need to be less active around the patient. The patient has a better patient management. You need less medication, and also that the patient can leave in the end the hospital before time.
So it's sort of like a prediction on the recovery, actually.
Exactly. So at the morning conferences, you can sit around the table and take the decision, what do we need for this specific patient, because we have all the records from the last 24 hours and specific for the night.
So you are the artificial eyes of the nurse.
Yes.
Not much. They need to still come with their hands and they need to come with their brains and the judgment, but you are the eyes of the nurse in there. How was the journey for you to build this business? How was to build an AI business in Europe, in Denmark, in a sector that is highly regulated, right, like the healthcare? What were the stoppers, and actually what helped you? You know, what made it easier? If there's anything that made it easier.
I think it was a very, very big help that there was an unmet need coming out from the hospital system. So we built the company and the business case on a real unmet need.
Yeah, so there was a problem that
there
existed
was a
and needed
problem
to be solved.
which we could solve. Secondary, we did it together with a rest hospital with the ICU unit. We had worked with around 65 nurses during 10 workshops. And for each of the workshop, we went home, built on the software program, coming back again, show what we have built, get a lot of responses because the nurse know exactly what the need is around the patient. And in the end, after we had trained on many patient, the ICU unit got the software to test it, and they tested it during a year. And during that year, we have a lot of different, components we need to
Adjust.
Light, one component. Light can change if you close the door. If you have the sun through the windows during the daylight. During the night.
But both in Denmark, also from the winter to the summer, it's very different.
So we have a lot of adjustment during the year to really end with a solution which work through all the hours in the day and also during the night. So we really can see what happened around the patient, and we can ensure that there's patient safety. Because as you mentioned, we are in the health sector and it's heavy regulated. When we started back in 2021, we have one regulation. That changed a little bit. The regulation we had at that time was a regulation with 27 chapters. And in the middle of the development of MIGO, they changed the regulation from EU to 127 chapters. So we also needed to add a lot of external consultings to help us and support with the documentation, because documentation is really a must when you develop health tech solutions.
Okay, now for real, do you feel like regulation in Europe is too heavy and it's impeding innovation?
Yeah, absolutely. Absolutely.
I was expecting an around answer, more
Yeah.
politically correct, but yes, I can see that
Yeah.
that you've
I
gone
think
through
I
fire
think
with
we
this.
have spent 2 more years on the documentation that we have planned from the start because of the change in the regulation.
Wow.
And that means that we also had needed to invest much more than we calculated from the start.
Go, yeah.
Um,
So the process with the nurses was a co-creation process. This
That
is
was
very
co-creation.
Scandinavian, I would say,
Yes.
and it's also definitely the best way to start a business
Yeah.
and solve a problem. The process then to develop this started kind of from scratch. But the problem in developing AI tools, besides the regulation, is data quality, data quantity.
Yeah.
How did you overcome this thing? So how did you get enough data points so you can train, right? And also how, I mean, yes, you explained a little bit, you did the workshops, you improve all the time based on like all these things. But how do you know, with this in mind, that your business is future-proof now if you go into other countries, right? If you want to expand to Germany or to other countries in Europe?
Yeah. It's a part of the regulation process. When you apply for an MDR
What is an
approval,
MDR?
MDR, it's the medical device regulation.
Medical device regulation.
Yes.
Yeah.
You need to file a technical file and a clinical file, and the clinical file include all your patient data. And the patient data is the 54,000 movements, the 100 million images, all the patient we have tested the solution on. That's a part of the clinical
trial
process where we really need to show that we have followed all the clinical practices and so on, and what have the endpoints been stated from the start, and we have complied with the endpoints in the clinical studies and so on. So that's normal when you develop health tech solutions or even pharmaceuticals, that you have a clinical study. When we talk health tech solution software, we also need to have a technical file. So that's the basic for that we got our approval as an MDR solution, and that's help us in the, you could say, in the scaling process, because there's an requirement from the hospital system, from the health system, that your solutions need to be MDR compliant.
Yeah, of course.
We also have protect what we could protect around IP rights and so on.
Yeah. That also takes some time, of course.
The third point is here specific in Europe, that you also need to be GDPR compliant. And that's a huge issue, specific when you're using a live video feed. And
because the patient cannot
exactly.
give GDPR for the people that maybe are looking from different spaces of the world, is this general data protection regulation, which asks for every newsletter provider, form filler, service provider, where you need to give your data, to actually have an in place system for consent. So you can take my name and my address and my phone number, but I have to consent for that. And then there's other things that you cannot do with it afterwards. It's a European specific regulation, but of course, this is also very hard for a patient that is in coma and cannot do anything, and you still need to film that, and you still need to train the algorithm. So then how did this go? Did you find families that were a little bit against of like, oh no, please don't film my wife or my husband, looking like that or in this position. Where's anybody, that was pushing back from, the obvious, the obvious solution that is actually bringing value, right, to the patient?
I think that when you're working in the health sector, and I have worked in the health sector for almost 30 years, and you're working with patient and sometimes very ill patient and the families, the caregivers around the patient, it's not very often you will get a no.
Because people are
most
desperate
people
to
really
just get
want
whatever,
to support, help,
yeah.
and patient who is coming out and getting better and so on, even want to also support and say, okay, yeah, I have been a patient. It could be a cancer patient.
Yeah.
I have had cancer. Now I don't have cancer. But if you can use my comments or my, you could say, knowledge,
my data,
yes, I will want to support. Because when the patient and also the caregivers and families support with data, we can get better solutions.
Yes.
We can get better treatments.
Yes, for sure. Yeah.
So we have not had any no's, not a single one.
So people become actually grateful to the artificial nurses or the artificial eyes of nurses for actually monitoring them, right, in that respect. If there wouldn't have been the regulations as harsh with you, where would you have been today? What would the artificial nurse would be able to do today?
I think much more. First of all, we will have been in the market 2 years after we had developed the solution, and we will probably have been not only in the European market but also at the US market. So the documentation, the time, the investment is needed because of the patient safety. But it's also time consuming, very much. But I think that will be more easy in the future.
Yes,
much more easier, specific with the support of AI.
Yes,
the documentation much easier today, even for the programmers to develop new coding.
But
much
even
easier
for compliance,
today. Compliance.
This is where I wanted to bring it. So,
Yes.
of course, artificial intelligence is going to make these things easier because they can do things 100 times faster, right, than we can. Still, there needs some human oversight. There's still people that need to oversee this. But for sure, they're going to make it faster. But on this regard, I wanted to touch a little bit towards, I haven't seen how the cameras look like. And we don't need to explain a lot. But I'm trying to understand if we go in 5 years from now, and let's say everything around is not going to be static, and we will have actually humanoids. So robots looking like people or not, looking like nurses or not. So like replacing more than just the vision, right? How do you feel the patient would react, and how do you feel the nurse will react? Will the nurse still have a role in 5 years, in 10 years from now? And if so, where? Because you do shifts, you get tired, right, as a nurse. You are a human, you are affected. Maybe it's a pressure, maybe it's 2 alarms in the same time, right, in the same rooms, and you cannot like split or... Tell me a little bit about what's your vision from 5 years, in 10 years from now?
I think the future and in the coming years, we will see that all the informations, and if we are just talking about an ward, an hospital ward, there's a lot of information. and it's single point information today. But with AI, we can combine all the information, and we can combine the information through the robots we can use, and we
IoT
can use some of
devices,
the
yes.
robots as agents, and we can build up agents who will monitoring different kind of needs around the patient room.
Yeah,
Not only the
somebody
patient,
looking
but
at the heartbeat, somebody like
exactly.
we already have the monitors, but
And
it's
also
the
if the
decision making.
patient will leave the bed to go out to the toilet, how long has the patient been on the toilet, coming back, and all that kind of information will be combined in real time, so the nurse can get the information in real time and know exactly how is the patient right now.
So you still see a nurse in the hospital in 10 years from now, a human nurse,
Yeah.
or is it going to be a robot?
No, that will be a human nurse.
But I'm thinking why? Because actually, I would maybe like to try it right now to be like, I was trying to imagine what will be the role, right, of a nurse, of a doctor, like in the future. Is it because we don't have enough information. We cannot even, process the information that maybe it is stored somewhere into our brain, but it's just not coming, at the right point. And of course, we have cases, right, of malpractice or cases of, just not diagnosing the way we should. So what is going to be the role of the nurse and of the doctor? How do you see that interaction when you can have everything mechanical, everything robotics, everything working, coming on time, connected, right? Exactly. Depending on what I feel about a heart, I can immediately change the medication, from the. So what will be the role of the nurse?
The role will be to make the diagnosis and take the decision. Do we need to interact with the patient or not?
So what you're saying here is that maybe it's easier to hear from a human, I'm sorry you have cancer, than actually hearing it from a from an AI?
That's one point. But also that we can train robots to monitoring and combined information. But in the end, you need to have the human mindset to take a decision. I don't think we want to have a robot to take a specific decision. Even that we know already now that if you take an physician and general practice physician and
an AI and you put them to diagnose,
exactly and ask them to look at patient and make a diagnose, that the AI machine will do it better. I think as a human, we need to have another human to talk with.
So you are actually hinting at the empathy, right?
Yes.
Just the feel of us, the
human touch.
Yes, the human touch, the safety or the what is the word? Just feeling more comfortable to receive these words from a human being.
Yeah, that's one point. The other point is when you are around the patient, you will interact with the patient. You will ask questions. You will get answer, and maybe you need to pick up a book, or you need to help the patient to roll over or something like that. That's also a job for the nurse.
Okay.
So there's the, you could say, the interaction around a question, but also the support around the patient.
Interesting. Yeah, I mean, for sure, there are ways, and we can see this in a lot of users of AI chatbots. That the interaction with them, it's very nice. That they like the reinforcement, that they get, which sometimes maybe as a human we cannot give because maybe we're tired or we didn't have our coffee or too stressed about some things, so we might be rushed up into that. So I think there are ways that in 10 years from now that we reach there where we will have humanoids looking like us and trying to blink in a way so they look empathic, right? Even if they are not empathic and they cannot feel the pain or the stress of a human, but you're still betting on the fact that there will be humans sitting there just for the smaller, just for the reassurance of that this is still a human a human space. Hopefully we're not going to see the round like sick robots, right? Because then that would be depressing. So
but I think that you will not only have monitoring solution like MIGO on the hospital, you will also have it in your home when you're a patient. And that will be a part of the whole trend we are seeing in the healthcare system, where you're moving the patient out from the hospital into the home care setting. One of the very big issues and challenge when you push the patient out from the hospital before time into the private home, and many patients really want to be in their own home instead of at the hospital, is that the patient in many ways don't behave as they should do. So we will see a very big need to monitoring also the patient at home when the patient still is a patient at the hospital, but is an outpatient in their own home. So we will see during the next, I think, 5 years, a very big request from the healthcare system to have the same possibilities to monitoring the patient in their own home, like at the hospital.
Interesting.
And the monitoring of the patient at their own home will be monitoring by the hospital.
Okay, so you sit at home. You just been to hospital, you're released, you're at home, and you have all this equipment and artificial nurses, right? If we want to call it like that keep an eye on you. And they give you the medication, they remind you about the medication, they take your vitals, they take the whatever analysis, that they need to do. And everything goes back to the hospital in the control room where nurses or doctors are sitting and they're reading the data to see if anything needs to be adjusted. Yeah. I mean, the AI as well can say if it needs to be adjusted or not, right? They're just getting this. But I suppose that you need to have a central database, right? Of like, this patient has been here. There needs to be a follow-up, right? On like what happens.
And you will have and get all the information and get it implemented into the patient record system. So again, you can on real time get the information around the patient and take the decisions, the needed decisions.
Yeah, and I feel again that maybe for people that have somebody at home, right, and then they have that human reassurance, right, of somebody to give them the book, right, and in turn, as you're saying, but what happens to the people that like live alone, right? How is this going to work for them?
I think specific for the people who's living alone, it's much more secured that you are monitoring by the patient also in your own home.
It gives even more value.
It's given much more value. And not only for the patient who's living alone, but also if the patient has family. We have heard many times from the nurses in the hospitals which is using MIGO today, that there's a question from the family members of, can we also get the same system at our family patient's home? So we on distance from our home maybe can monitoring. It could be a father and mother, granddad or something like that.
Interesting.
So there's a need to ensure that patient who's living alone are monitoring, not only from the healthcare system, but also from family members.
Are you happy with the speed of your algorithm, the speed of developing the AI, what could be better? Like what would it make your life easier? And don't say money, because
no.
yes, that's a thing that would make everybody's life
Yeah,
easier.
the challenge and specific in Europe, it's the very long decision times in the healthcare systems to adopt and scale new solutions.
I've seen actually on the table of the European Union that we're discussing about making the public sector, public administration, being more open towards collaborating with startups and actually acquiring European solutions, right, at the European level. So we know that it's on the table, but we also know how long it takes from from the
But
table.
it's not only on European level; it's also local level. The decision time just here in Denmark is very long, and you have so many stakeholders from the healthcare system. It's not only the specific department; it's also IT. It's procurement if they need to interact. It's the organization who has the responsibility for the real estate part of the hospital. It's the hospital management if you need to have a bigger budget for the investment in a solution. On the department level, it's the management team, it's the nurses, it could be the patient, it could be the caregivers, families, members, and so on. So it's a huge stakeholder map we are working with, and sometimes the decision will be taken by the hospital management team, sometimes by the department team, or even that there's a request from the nurse team to get some support.
So it's about the decision time, and it's what I hear from here. Of course, this is the normal process of adopting something new, where decision makers are scared to risk. They don't want to, adopt something that might not work and might come, back on them. But do you feel it's even harder for something that wears the AI label? Do you feel like people are more resistant towards adopting AI solutions?
No, not at all.
No.
I will say that when we mention it's an AI, they are just yes, good.
Okay, that's interesting.
That's not the challenge. The challenge is more that we have a lot of requests from department levels to buy and use the MIGO solution.
Yeah,
but we have all the other layers.
all the chain of command.
All
that
the
needs to, yeah.
exactly. That's the challenge. That's the biggest challenge.
Yeah. Again, it's the health sector, but I suppose in general that we are struggling with this. I think in Europe, in the decision-making level, we are slow. We are slow in trying out pilots, in making the case for business. We are slow in releasing money, right, when they need to be released. And yeah, I see this as definitely a point where we can improve. As a final note, M2Call and the MIGO solution, what can you send as a message to the general public in relation to how to use AI, why to use AI, when to use AI? I think at the end, of this discussion, my deep question is, and you kind of answered that maybe nurses should not be scared of being completely replaced. But though, none of them, or maybe a part of them. Yeah, please bring it on. Like, what will happen in the world of AI? How will AI impact, the citizen on the street, and how it will impact the nurses?
I'm back from that time when I started to study where we use pen and paper. And AI, you could say, is just a develop of the pen and the paper. Between the pen and paper and AI, we had the typewriting machine. We had the PC with Perfect and Word and Excel and so on. AI is a way to collect data across all the different databases we have, so many platforms, websites, and we can do it in many ways. So it's just a develop of the pen and paper, but where we much quicker can get an overview of the exact situation. Not only of the exact situation, but we can also get some advices. Instead of you need, as a nurse, look in the book, what should I do in this situation? They can get it immediately.
They only need to take the
They
decisions.
just need to take the decision. So it's a really huge support.
Yeah.
MIGO is not a solution which will decrease the nurse resources on a hospital.
No.
Because there's not
enough anyhow.
enough
Yes.
anyway.
No.
So it's more that the nurse can use the time of the real needs instead of you use time
Waste
on
time.
something
Yeah.
which is just wasting.
Yeah, interesting. Cool. I have two more things. One that maybe I would like to take this point a little bit earlier into the episode, and that is, how can this solution, and again, can be used for harm? Can it harm in any way? Far-fetched, and this
that's a very good question again. MIGO is an standalone solution which is inside the hospital. So we don't have any data in a cloud. All data is internal at the hospital side.
Okay.
It
cannot be hacked in the cloud
it can't be
retrieve
hacked.
images and create.
Exactly. And the nurse don't record the video stream. They can do it, but they normally don't do it. And also, we are working what we in the IT language defined as tenets. It's meaning that if you are on a specific ward, you can only attend the patient on that ward. You cannot take your application on your hospital phone, walk down 10 levels to the basement and have access to the patient. You only have access to the patient on the department
because
level.
You're there to act on.
Yes.
So if you cannot act, why receive anything? Yeah.
Exactly.
Interesting. Yeah. So you actually have quite good guardrails in place
that's a big part of the GDPR
yes.
compliance legislation that we need to
what?
Store everything at the hospital.
As a citizen, and hopefully not the very soon future patient, I actually feel good, for to hear that there's some things in place that actually forced a setup where I'm not scared, that something happened. But anyhow, if I would be Mads Mikkelsen, right, sitting out there, I guess there will be opportunities for a nurse to leak to paparazzi a picture that is
yeah, but it's it's exactly as the other regulation in the public sector. You can't and it's illegal to attend information you are not allowed to attend.
Yeah, but this comes in the Hippocrates. What is it called?
But you could also, just go into the patient, take your private phone, and make a snap
But again,
yeah,
exactly
yeah,
that can happen without
that
the app
could
and
happen.
without the vision. So
Yeah.
it's not the GDPR. Well, the GDPR as well a little bit, but it's also the
It's
Hippocrates
yes,
oath that
yeah,
keeps nurses
exactly.
and doctors, into
Yeah.
not doing this ethical. Cool. Yes, this is optimistic. This is pessimistic. This is I'm neutral, right? AI, it's a good thing for the world. Yes. AI needs humans more or human needs AI more? Do human needs AI more or AI needs humans more?
No, I think it's a split.
It's a split.
Yeah.
So collaboration,
Yeah.
co-creation.
Mm.
Yes, it's definitely a co-creation. And yeah, when are you going to come next time? Thank you so much. Thank you so much, Michael Lange from M2 Call with the MIGO app for actually coming and explaining how the artificial nurse works, or the eyes of an artificial nurse works. And we'll see you at the next episode. Thank you so much again.
Thank you.